start our recording.
This meeting is being recorded.
Excellent. And I'm gonna, if you don't mind, if everyone could just keep on mute, and we'll have time to open it up to questions at the end. And I wanted to thank Amanda Shearer for collecting some questions from the Facebook group in advance. So we'll start with those questions, and if we have time, we'll be able to open it up to others for questions at the end as well. So can everyone see my screen? Yes. Okay, great. Awesome. Well, welcome to this family update meeting with Dr. Shashi and Dr. Peña. And we also have a couple members of their team who are here to help support as well. I'm going to talk a little bit about the R Foundation just to kick us off, and then an exciting new project that Dr. Shashi and Dr. Peña and their colleagues are working on. And then from there, we'll move into some questions. So I'll go ahead and start with just a quick updates. So the agenda for today, as I said, updates from me, some overview and updates from Dr. Peña, Dr. Shashi, and colleagues, and then we'll do some Q&A at the end. So really quick history about the R Foundation. We were founded in 2018 by Loren Peña, who's mom to Alex, who has the asxl-1 mutation. He has Boring-Opitz syndrome. And our board of directors includes 5 parents of kids with asxl-related disorders. We have 3 Boring-Opitz syndrome parents and now 2 Bainbridge-Roper syndrome parents. We are still looking for a Shashi-Pena Syndrome parent to join our board. So if that is of interest to you, we would love to chat further. So if that's something you might be interested in learning more about, please feel free to reach out to me after this meeting. We're really eager to make sure that our leadership is representative of all 3 of the asxl-related disorders that we represent as an organization. There's just 1 full-time staff person, that's me, and then we have some project-specific volunteers who help support the rest of our operations. As I mentioned, we support all 3 of the asxl-related disorders. We funded over $550,000 in research grants so far, and are gearing up to make some more investments in research towards the end of this year and into next year, largely based on the research roadmap that many of the families who are here today helped contribute to. And then we host 2 events. Every year we host the ASXL Research Symposium, that's for researchers and clinicians. And then every other year we host the ASXL Family Conference, and I'll talk about that in a couple of moments here. So really, as an organization, we have a 2-part mission. We are here to support families through education, like programs like this, and to build the research community. So building the number of people who are interested in studying the ASXL genes and what they do, and developing better standards of care for all of your kids. And right at the middle of that intersection is the family participation in research, which is one of the things that we're going to have a chance to talk about today with some exciting new opportunities for the Shashi-Pena Syndrome community. A quick sort of preview of what's ahead for the R Foundation. We're working on launching a program for newly diagnosed families that includes some new educational resources, and then sort of behind the scenes working on some strategies to help new families find us as soon as they're diagnosed, so we can connect them to information and support as quickly as possible. We've hired a scientific advisor to help us grow our research network through an organization called Combined Brain, and they've been with us just for a couple of weeks and have already made a huge difference in providing us with some really great advice and expanding our network. So we're excited to see the continued momentum that will bring to us throughout the rest of this year. We're continuing to support specific research projects, including this Shashi-Pena Syndrome Gene Reviews article, which we'll talk about in more detail. And then the 2023 Research Symposium for Professionals will be this summer in July in Boston. A couple of new resources to mention. This is hot off the press. I don't think we've announced this in any other venue yet, so you're the first to know about this new resource called our ASXL Care Directory. This is a family-sourced database of healthcare providers. You can catch a sneak peek at ourfoundation.org/findcare. We will be fully launching it on Rare Disease Day on February 28th at the end of this month. So if you're interested in getting a peek, you're welcome to go to that URL from our website and check it out there. We're also looking for some initial submissions to help build the database when we launch it at the end of the month. So if you're interested in submitting any members of your child's care team who you would recommend to other families, you're welcome to do that now. We also have two new articles. The first one, What Causes ASXL-Related Disorders, is published. It's available on our website. And we have another one coming called Epigenetics 101. And this is really part of our effort to help families really get a better understanding of some of the genetic mechanisms behind what causes ASXL-related disorders, and help them understand some of the pathways that we are looking at in terms of how we can help find better treatments, and prioritizing the research work that still needs to be done to help us understand these things a little bit better. And as always, our ASXL resource library continues to expand as we add new resource videos, recordings from our conference, that sort of thing. That's available on our website, and I invite you to check that out anytime. So a couple of important dates just to have on your calendar. Shashi-Pena Syndrome Awareness Day is October 6th. We had a great t-shirt sale last year. We're planning to do that again this year. The deadline for that will probably close sometime in mid-September. So if you're interested in getting your Shashi-Pena Syndrome t-shirt or being a part of any of the fundraising around that very special day, keep an eye out for announcements to start for that in late August and through September. And then the 2024 ASXL Research Symposium and Family Conference, this is the one that includes both the research community and families, will be in July 2024. So either the third or fourth weekend of July of next year on somewhere in the United States on the East Coast. So we don't have information to formally announce yet, but are working on that and hopeful to have something to share with families in the next month or so as far as a specific location. So next, I'm going to turn it over, I think, to Becky Spillman, who is Dr. Shashi's genetic counselor. She's going to share some information about what we need from families to help build this really important publication for the medical literature. It's called a Gene Reviews article. This is a go-to resource for the medical community. So if someone is newly diagnosed, or you're walking into an appointment and you're seeing a new provider and they need to sort of brush up on what Shashi-Pena syndrome is, this is one of the sources that they might go to look for some information. So it's a summary of everything we know about Shashi-Pena syndrome to date, and our wonderful research community that's on the call with us today needs a little bit more information from you. So I'm going to pause here and turn it over to Becky, who's going to share a little bit more information about specifically what we need from families.
Thanks, Amanda.
Yeah.
So like Amanda mentioned, Gene Reviews is that one-stop shop. It's where providers who may not know a lot about genetic conditions go to, and it gives a really great summary of the condition, as well as some hallmark features to look for if a physician is thinking of a syndrome, what genetic testing should be done, as well as management type of things. So if a patient is newly diagnosed, what provider should they be seeing, what things to look out for in the future if they haven't been diagnosed with those particular symptoms yet. So like Amanda's saying, this is really the one-stop shop for everything about a condition. And right now, there is not one for Shashi-Pena syndrome. So we're in the process of writing that and pulling that together. The original article only had 7 patients in it. And we know, as we see here, there's been a lot more patients diagnosed. And we know that the symptoms are more than what was just initially published. So what we're going to be doing is we're going to be reaching out to families, some that have already been diagnosed, newly diagnosed, or maybe even previously described. And I'll be talking to you about the symptoms that your kiddos have. What type of symptoms they're having, what type of concerns you may be having, and collecting the medical records on them and doing a really detailed review of the symptoms so we can really get a complete picture of what to expect from Shashi-Pena syndrome, so that we can write this and really try to capture as much of the symptoms as possible so these providers can really be aware of what to look out for and what we can tell newly diagnosed families. Right now, we are looking to get approval from our IRB in order to be able to collect this information. But once we get all of the approvals necessary, I will be reaching out to families, asking to collect this information and to have kind of an interview kind of conversation with you about that. A number of you have already reached out to me, emailed me. I think Amanda may have posted it on the Facebook page, have reached out to me with genetic information and just some background information about your kiddos. If you haven't, Amanda has my email address. You're always welcome to reach out to me. And once we have all the approvals, I'll be in touch about consenting and gathering information if this is something that you're interested in doing. Again, this is not a requirement. This is not something mandatory you have to do. This is just something to really help the research community and get as much information out there about Shashi-Pena patients.
Thanks, Becky. So I think we're going to move. Oh, go ahead, Dr. Peña.
One thing that I wanted to add to what Becky said is that Gene Reviews is available to everybody via a website. It's supported by the National Institutes of Health. So this resource that we're all putting together is actually available to everybody. And so for particularly for families who might have a new diagnosis, the families can read this, even though the primary audience is physicians. So there's a lot of shop talk in there, but for your provider, for your physician, it could be really useful as well.
I also wanted to add one other point regarding us getting information from all of you as families. Gene Reviews has given us time till July to get this article done. And while that might seem like, oh, we have 5 months, all of you know, getting medical records is not an easy task. And although Becky will get your consent and we will try and get those from your medical institutions, it's going to take some time. So if any of you is interested in participating, once we reach out to you, if you can get your medical record releases back to us sooner than later, we can get this accomplished in the time frame.
Thank you. So I think we'll move into the Q&A. I know we did a really good job collecting questions in advance, and when I shared them with Dr. Shashi and Dr. Peña in advance, I said, let's spend a little bit more time on Q&A than we had originally anticipated to make sure that we can get to everything. Before we do that, I know you both just spoke, but I think that we do have some new families here. If both of you don't mind just introducing yourselves briefly. So maybe Dr. Shashi, would you be willing to go first?
Yeah, sure. So I'm Vandana Shashi. I'm a pediatrician and clinical geneticist. I'm based at Duke University and had a long interest in ultra-rare disorders. So asxl is one of those ultra-rare disorders that we identified 5-6 years ago was our index patient, and Loren and I were working together, and so was Becky, and so that's how this all started.
Dr. Peña?
And my name is Loren Peña. I'm a clinical geneticist. I used to be at Duke where I work with Becky and Dr. Shashi. But about 4.5 years ago, I moved to Cincinnati. And so we continued to work together, but now I'm based in Ohio.
Great, thank you. So do either of you have anything to sort of overview you'd like to do very briefly before we move into questions, or would you like to start with questions now?
I think I'm fine starting with questions. Loren, how about you?
Same here. I was going to say that.
Okay. So let me share screen again here. Okay. Can everyone see the slide with the questions? Okay. So I grouped the questions that came through the support group. There's two sort of primary themes. One are questions sort of about the syndrome, and then one more specifically about treatment. So figured we'd start with the bigger picture questions first, and then can move towards some of the treatment related questions. So I'll just start reading and let either of you take these that you'd like, and we'll just try to see if we can get through all of them in the time that we have here. So first, do you think hearing loss is related to the syndrome?
I can jump in, and Loren and Becky can add to it. It seems like it's emerging to be one of the symptoms and signs we are seeing. We're aware of families and physicians that have contacted us where the child has the diagnosis of Shashi-Pena Syndrome, has the features that we would expect to see. So the diagnosis is not in doubt, and they also seem to have hearing loss. We are trying to gather information related to that for the Gene Reviews article, so we can have a better idea of what percentage of children or adults might have this, what types of hearing loss are we seeing, is this something that progresses over time, and what are the potential treatments that these children have had. Becky, you might have some more granular information. Do you know how many we have had so far that we know have had hearing loss?
I can pull that up. I don't know off the top of my head how many, but I do know that that is something that does, as you said, does seem to be emerging as a more common feature than we may have originally expected.
Okay, while you pull up, sorry, put you on the...
Oh, you're still mute.
Oh, sorry, Becky. While you're looking that up, I don't know if Loren has anything to add to that.
Okay.
Nope, I don't.
Okay, so we'll go to the next question, and Becky, we can come back to after you had a chance to take a look at that. So, so my child does not seem to have classic symptoms of Shashi-Pena syndrome. Is there an alternate classification for kids who don't have the classic symptoms?
Amanda, I can take a crack to begin with this one.
Go ahead.
So I think that there's a lot of nuance to this question, and we've been having some internal discussions because what we described in the original paper from 2016 was, you could see that there was a facial appearance that could evolve over time with the majority of patients as they aged. But subsequent to that, we have had questions from individuals or families who have children who have a different kind of mutation from what everyone in the original group described. And the symptoms in those cases are not the typical symptoms that we described in our original cohort. So I am wondering if part of this question falls in that category of changes in the asxl-2 gene that are a little different from the ones in the patients that we originally described.
Yeah, I agree with Loren. I would add to that, if whoever asked this question has, specific issues related to their child's diagnosis, we kind of informally get emails and questions from patients' geneticists, other physicians about a particular variant or a particular child's phenotype. We are happy to help you in that context. If you want to work with your physician and get in touch with us, we can certainly talk to your physician about this. It's kind of crossing that border between being a researcher. We can be your clinician because we don't have that relationship with you, but we can kind of just give you a general gestalt of, oh, we've seen this kind of variant before, but it's not associated with classic Shashi-Pena syndrome or the opposite. So we can certainly help you in those informal ways.
Okay, so this all came from one person. So just questions if these were typical symptoms of and challenges of Shashi-Pena syndrome: testicular issues, eyesight, specifically nearsightedness, sleep problems, including insomnia, and then teeth or mouth issues. If these are symptoms that you would consider typical of the syndrome.
Loren, I can take a stab. I don't know about testicular issues per se. Maybe there, and I don't know what that specific question means, because testicular issues can mean a number of different things, from undescended testes to, puberty being delayed or puberty being early. It's hard to know. There are some children, there are sleep problems associated that we know of, where disturbed sleep, difficulty falling asleep, maintaining sleep. Again, it seems like I'm always going back to the gene reviews, but really looking at an expanded cohort of patients will help us kind of identify and describe these kinds of problems. Eyesight and nearsightedness, I don't know of it being a feature that we kind of honed in on in the original paper. But one thing to remember is, in childhood, nearsightedness is a very common thing. Over 10-15% of kids will be nearsighted when they're typical. And in children who have developmental problems, minor eyesight problems are quite common. So I don't know if it's specific. I don't know about any specific teeth issues or mouth issues. Loren, did you want to comment on that?
Yeah, I agree with all your answers. I haven't heard of any particular tooth or mouth issues or testicular issues for the patients. And then nearsightedness is so common among the general population that unless someone's falling in a more extreme range, and multiple patients are described with more extreme nearsightedness, and we start to really wonder if something is related to the condition, because that would be very unusual.
Thank you.
I just went back through about the hearing loss, and of some of the newer patients that we have been gathering information on, it looks about like 25% of the newer patients have reported some type of hearing loss. What that means for the overall population, I don't know, but from the new patients we have. And just about the teeth and mouth problems, I was just scrolling on my list. It looks like there are 2 patients who have contacted me that reported either early teeth eruption or late teeth eruption, but nothing necessarily about differences in the actual teeth, just either early or late teeth eruption, whatever that means. Again, we don't have the medical records on those, but that's where the gene reviews would be helpful.
Safira is already developing her wisdom teeth. They haven't brushed through yet, but they're obviously there on the x-ray. She's already got her second molars and she only has 1 baby tooth left, and she's 8. And she lost most of her baby teeth, very early on. She had been holding on to the last of those for like 2 years now.
I see comments in the chat about teeth as well as issues related to sleep and glasses, and feeding problems can be seen. Even in the original report, there were feeding difficulties described, usually early on, and sometimes may or may not be related to the low blood sugar can go along with that. But the feeding problems do tend to get better over time. So I'm hoping that that was the case for your child as well. One thing to remember about any genetic condition, it's very unlikely that one child who has it is going to be very similar to another child who has it. Just like as we are all individually different, we are going to find some individual differences as well. And there are going to be outliers for some features as well.
Thanks. All right, so we'll move on to the next one here. So these are more questions sort of broadly about Shashi-Pena syndrome. So is Shashi-Pena syndrome the cause of my child's autism, or could my child have both Shashi-Pena syndrome and autism separate from each other? If that's even an answerable question.
Yeah, I said it's a really good question, and there isn't a good answer for it that we could say that we know. It's guessing at this point. It's kind of conjecture and basing on what we know. Certainly extrapolating from many different genetic conditions, autism is associated with many different genetic disorders. So for example, even something as familiar to most people probably is Down syndrome. 10 to 15% of children with Down syndrome will get a diagnosis of autism in their lifespan. So there's an association. So we tend to infer in those situations that, yeah, maybe the Down syndrome is the cause of the autism. But how do you prove that? That's a really hard thing to do. And I would say it's the same here. There's probably an association with autism. We've heard of a few children with Shashi-Pena syndrome who've been diagnosed to have autism. But also remember, autism is a common thing in the general population these days. 1 in 8 children tends to be the latest. So we don't have any definitive way at this time of either linking it to it for sure, or to say, oh no, there's another cause here for the autism. If there's something else identified, it's fine. But if there isn't another cause for the autism, it's really hard. Loren, do you want to add to that at all?
No, I mean, I think that it's a very nuanced distinction here, and not being a developmental pediatrician, I don't know all the rules for diagnosing autism, but it's going to get really hard to tease out what's strictly Shashi-Pena and what's autism caused by something else. I would say it's going to be virtually impossible to tease it out.
So Safira doesn't have a autistic diagnosis, but I myself have been around several, I don't want to say variations, but severities of autism, since it's on a spectrum. And something I've noticed with her is that she seems to have autistic-like traits. So that socialization part, she's super social, she's huggy, so the touching tactile, it kind of rolled her out a little bit. But she does have a sensitivity to frequency. So her hearing is good, but she does have an issue with like kids screaming. But she can be in front of a live band, or percussions are okay. And when she gets excited, she goes like this. these little spirit fingers. So she, you know, and the way she socializes, she doesn't understand social cues and those kinds of things. So she appears to have autistic-like traits, but I don't know if that means she's technically autistic. We just haven't seen the right person to get her, you know, that direction of help. So I didn't know if that's, you know, with that question, would that be something relevant to look into for her? So.
I would say the reason to look into it further is if you feel like she needs more services for these traits that you're seeing, for example, more help with her social skills. You're completely correct in what you're describing. I think that's what Loren was alluding to earlier. You know, there's this diagnosis of autism that they will do based on the structured assessments they do with the parents and the child's observation, things like the ADOS. And then there might be children with Shashi-Pena who do qualify with those kind of instruments. And then you have others who don't qualify, yet have these behaviors or traits that
Right.
are reminiscent of autism, but not enough to make that diagnosis. Yeah, but in a situation like yours, if you feel like she would benefit from other services, having a diagnosis of autism can open doors for you. You know, there are families, we have no data with Shashi-Pena syndrome, but in general, things like ABA therapy, and all of those will never be available unless you have a bona fide diagnosis. So for services, it might be useful.
Great.
Great. So the next question, I'm going to ask whoever answers this to maybe give a little bit of the genetic background for why this question has popped up. And I know the person who asked this has done a lot of reading. So could my child develop leukemia in the future, and why might that be a relevant question for this community?
So the asxl-2 gene initially was described in the context of the cancer literature and having changes in malignancies. But our paper was the first time that linked asxl-2 changes to what we call constitutional disorders or neurodevelopmental disorder. And so what I'm saying is that when in those malignancies that have been described previously, the change was only in the affected cells. So the person was not born with a change in the asxl-2 gene, you know, since conception. So it seemed like these changes for malignancies were acquired as the DNA in the cells changed. So the cohort, and this is not an unusual story in genetics, because we're finding that more and more genes that are initially described in the context of malignancies, for example, then find a neurodevelopmental disorder or some sort of genetic disorder that individuals are born with, because the change in the gene is present since conception. And so the answer to the question is, could my child develop leukemia in the future, is we don't know, because, and it hasn't been described in any patients that we have heard of. So that is certainly something to think about, but there isn't enough information at this time to definitively say or definitively recommend screening for leukemia in these patients, just because we don't have the information to do that. Vandana, is there anything you'd like to add?
No, I just wanted to reemphasize the point Loren made. There are dozens, if not more, of genes that we know for many years have been associated with cancers. When you look at the tumor tissue, you find mutations in them. Those genes, different mutations, or maybe sometimes even the same, we are seeing also associated with neurodevelopmental syndromes such as Shashi-Pena. So this link is not unique for asxl-2. It's out there, and we are not aware of increased cancer risk because of this link. But time will tell.
Great, thank you. And then what is the chance of my child passing the syndrome on to any children they might have?
I can take that one. So once you have that DNA change, It's there in all of your child's cells, including their ovaries and testes, where they would be making sperm or they would be making eggs. So having a change like this in all of your cells means that when you go on to have children, all of your genes, all of our 20,000 genes, we have 2 copies of every gene. For all of those genes, we only pass on 1 copy. So for every gene that you have, you pass on 1 in either the egg or the sperm. So for the asxl2 genes, if you have 1 copy of the gene that has that mutation and the other copy is fine, there's a 50-50 chance of that being passed on with every pregnancy for your child, since that's your question. So, and there are, of course, lots of options for prenatal and pre-implantation diagnosis and things like that, that you can have that conversation as your child gets to that point.
Thank you. And I mentioned earlier the article, What Causes ASXL-Related Disorders. We do cover some of the inheritance questions in that article as well. And there's a diagram that sort of illustrates what Dr. Shashi just described as well. So I encourage you to take a look at that article. It might be helpful to you. And of course, if you have access to genetic counseling, that's another great person on your team who you can ask some more specific questions about. Okay, so I'm going to move on to some treatment-themed questions here. So I know we've got a very international audience on the call here today. We're fortunate to have Dr. Shashi and Dr. Peña here in the United States, but are there any doctors in the UK or elsewhere around the world who may have an interest in Shashi-Pena syndrome, maybe that you've heard from individually? And the second part of that question is a question that the R Foundation is really interested in. How can we inspire more doctors to be more engaged?
Loren, do you know anybody in the UK? I'll let you jump in if you do.
I haven't. What I was going to say is that over the past few years, there's definitely a number of providers who might not have an ongoing research interest, but are interested and invested enough to contact us. And that helps us because that sort of gets us started with a group of providers who may have a patient. And the disorder is rare enough that we wouldn't expect that there would be one provider in the UK who has multiple patients, but at least if we get started with one here and one there, we can learn. So it's a two-way street. We can share information with those providers and the families, but they can also share with us information, maybe with findings and symptoms that we haven't heard about. So it very much works in a collaborative way.
Yeah, I agree with that. And I think probably genetic services are very different in the UK than they are in the US. They're more centralized in the bigger cities. And I can't imagine every, smaller counties or places that are slightly remote having easy access to genetics. So I think if you have a clinical geneticist who's kind of services your area through the GP, perhaps, or another specialist that might be taking care of your child, you could find out who that person is, get a visit with them. Clinical genetics is a very good starting point for you to identify somebody. Even if they've not personally seen a child with Shashi-Pena, they will know enough about how to brush themselves up on the condition, research more for you. And as Loren said, we're very good about contacting each other when we have a condition we're not familiar with. I do that all the time. If I'm seeing a child and there's an expert in Boston who described it, I'll email them. So that might be a way for you to get them engaged as well.
Thanks. And I think that that Find Care directory that I mentioned at the start of this call, one of the questions when you submit your care provider to be included in that directory is giving the foundation permission to try to reach out to that person and pull them into our network. So I think everybody on this call can sort of help us with that. And we are hosting now quarterly clinical roundtable meetings that are a great way to try to engage some more of those clinicians. So we have a very tangible thing to ask them to do on a quarterly basis, which is to join that call, get on our mailing list, and I think we have ways to help continue to build their engagement, but certainly need help from families in identifying who those people are around the world. Okay, so the next question, are there any supplements that could help my child? I'm guessing this may be a hard one to answer without more specifics, but if there's anything that you're aware of, I'll leave it to you to try to answer that one.
I suppose I would wonder if the question is, are there any supplements specifically for Shashi-Pena that could help my child, or are there any supplements for my child's seizures? Or there could be many different ways that we could interpret this question, but I haven't heard of any supplements for either the global syndrome or any complications of the condition. I haven't.
Thanks.
Me neither.
Great. Thank you. So next question. So is there any medication that's more helpful than others in addressing severe behaviors? And I know this is a topic that's been pretty hot on this Facebook group, people sort of sharing stories about some challenging behavior, including aggressive behavior to others, self-harm. And I think everyone's eager to try to find a medication that might help mitigate that sort of behavior.
Yeah, unfortunately, I feel for the family who's written this. These are hard things to cope with. But unfortunately, when we have a total number of patients of less than 50 at this point that we are aware of, it's really hard to get specific information like this. I will say, though, as hard as it is now, with more and more information becoming available and with more patients being diagnosed and us being able to get more information on this kind of thing, there may very well be specific things that we find works better, but we're just not there at this point.
There's a question on the chat about supplementation with individual concerns, and I don't think that there's a specific answer for that. The way that we treat complications of a condition is exactly that way, unless there's an approved treatment for the genetic piece of the condition, which is rare. So if somebody has low iron, for example, and they need iron supplementation, that's what they get. But other than that, there really isn't anything specific, even for the individual concerns.
All right, so we'll move to this is the last slide of questions. So for all the families, we're going to have some extra time to turn it over to you. So be thinking about the questions that you might have when we get through this slide here. So treatment-oriented question. So is there a treatment that could, quote unquote, cure or fix the ASXL2 mutation? Is that a possibility out there somewhere in the future?
I can get started. It seems to me that it's always possible. It's something that we can strive for. Typically, the first thing that we need to understand is the mechanism of the molecular mechanism that leads to changes in the cell as a result of the mutation in the asxl2 gene, and then what the function of the gene is. Because the changes in this gene were described in the context of malignancy, then we can have some understanding at least of what that aspect of the gene function is. But for neurodevelopmental disorders, it would be important to get that understanding too. So before we can get to a cure, we need to have some more, you can say, reagents to understand what this change might be doing. So, and when I say reagents, that might mean if somebody is willing to contribute a tissue sample to a biorepository where it's stored and investigators can use it. If somebody is going for a surgical procedure and they're willing to get a skin biopsy as part of an incision site, for example, if it's surgery, and contribute that to a biorepository, all those things are really important. And then, because then if you have if you already have tissue stored and you have investigators who are working on understanding the function of the gene and the effects of mutations in the gene, then you can just say, look, I already have X many samples in the biorepository, and that can really be helpful to the investigator and to the general community.
And I believe in the ASXL registry that's housed at UCLA with Dr. Russell, I believe that in the biobank, there are only 2 ASXL2 samples presently. So that's something that the family community can collectively help us try to improve. So Dr. Russell has had some really positive changes with her registry staff in terms of helping to increase sample collection. So that's something that the R Foundation will be reaching out to all ASXL families about in the coming months about trying to increase enrollment in both the registry and the biobank, which includes providing a blood sample to help us build that biorepository so that we can have those that data and information that we need to make more progress in this area.
Sometimes that requires a little bit of advanced planning. And so what that might look like, for example, might be I signed our family up for the biorepository, and I'm going to the geneticist or the fill-in-the-blank provider, and I already know that there's going to be samples drawn for other labs, clinical labs. And so I'm going to go in with all the info that I need, including, you know, how much and what kind of tube is needed, so that I can take advantage of the blood draws that I know are already going to happen, and they can draw me an extra sample in this tube. And then I have everything that I need and I can contribute. So it's hard to do it on the fly. We appreciate that, but sometimes it just requires a little bit of preparation if you know you're going to a doctor's appointment.
Absolutely. And we do at the family conference in 2024, we will host again the research room, which is an opportunity for all of that sample collection to happen there. So that's one more reason to plan to come to the family conference in 2024, is you can have participate in as many studies as we have available in sort of a one-stop shop in the research room at the family conference in July 2024. Excellent. So next question along the treatment lines as well. What are the most promising treatment pathways, and are there any pathways that may not be viable based on what we know now?
Loren, maybe you can start, since this is more your forte, with things like maybe ASO's gene therapy, and I can add repurposing as an option and where that might stand.
Mm-hmm.
Go ahead.
So I think that it all starts with what do changes in this gene do, and how do they compare with the normal function of the gene. And so in our paper, we proposed that the evidence was that the downstream effects of changes in the gene had led to what we call gain of function, meaning that the gene seemed to be more active than expected. And so if that is the case, then some approaches that we could think about would be ways to dampen the this gain of function to try and get it closer to the baseline function. And so there are different ways of doing that. Antisense oligonucleotides might be one. There's RNA methods that can also dampen an overactive gene product. Gene therapy, at least in Gene therapy, at least in theory, could get there, but it's a little bit, it's not the way that gene therapy is used these days. So those are some ways that we could, but I think that there's still work to do because we don't, even if we say gain of function, we still don't know gain of function in what way, like what gets, what function actually goes up downstream of the gene, what target genes are upregulated or downregulated, what's the, what other downstream effects are a result of this gain of function. So, Vandana, do you want to talk about repurposing?
Yeah, sure. Another avenue that Loren talked about how this gene might be overactive is, again, that's what we think. We have to prove that. But if that's the case, then there might be already approved medications for other conditions that the FDA, for example, has. There are over 2,000 drugs that the FDA has approved for different conditions. So you could test a compound of those, a library of those compounds that might tamp down this gain of function. And the advantage of, and then use that in a clinical trial. The advantage of repurposing a drug like that is you already have safety data on that. You don't have to worry about starting from the beginning, but you don't know what the side effects might be. And is this even a safe compound to be tried? What do we need to be watching for? It kind of circumvents those kinds of concerns. Even there, we are not there yet. As Loren said, we still don't understand the basic function of ASXL2. So that's really the starting point. One of the downsides for all ultra-rare disorders, including Shashi-Pena, is to do a clinical trial in any of these models we talked about. You need to have what's called as a control condition and a study group, meaning that some people don't get the actual medication. They get a placebo maybe, and the other group gets the actual drug, and then you compare. That's really hard to do when you have small number of patients, but there are ways around that. There's something called as N of 1, where every patient can be their own control. So we'll have to think very creatively. And another issue is to engage, people like pharma or people who are into drug development. If you're not going to do repurposing, for example, you have to engage them in this whole process. So there are challenges. It doesn't mean that there isn't hope. It's just going to take time.
I think one of the exciting things about the research symposium this summer is Dr. Peña is on our planning committee for that symposium. We have a whole session focused on therapeutic approaches and have invited representatives from several different genetic disorder related pharmaceutical companies and biotech companies to be a part of that conversation. So I think we're doing everything we can do to bolster that learning and help us move farther down that path. And I do want to, we have sort of a special guest on with us. She wasn't expecting to speak, but she messaged me in the chat, and that is one of our scientific advisors is on with us, Rachel Heilman, who happens to be a clinical pharmacist. And so she had an answer to the supplement question. So Rachel, I will invite you to come on and maybe just do a quick introduction of yourself, and if you have something to add about the supplements question based on your professional experience.
Sure. Thanks, Amanda, for putting me on the spot. So actually my background is in clinical pharmacy, and I've practiced for 15 years. So there actually are a handful of studies, like clinical trials, are even ongoing now around like omega-3s and supplementation in autism. I mean, but the data that's come out is relatively mixed in terms of like how it impacts behaviors and socialization characteristics. So, it's very hit or miss. And I think in general, there's some interest in looking at supplements and antioxidants, especially either alone or in combination with a lot of neurodevelopmental diseases, but it's very much in its infancy. And honestly, you hear from a lot of parents that this is what they're using for their kids because it's accessible. and you don't need a prescription for it. I mean, the one thing I would just caution you about is quality, because it's not regulated by the FDA. You need to make sure that you're getting like a good manufacturer. And so looking for a stamp of approval, either USP or NSF, which means the companies have been vetted a little bit more from a manufacturing perspective. So that's kind of my my take on supplements is a lot of people are doing it. It's accessible. We just don't really have any data to support like whether or not it has any benefits. I will say from like a fish oil standpoint or DHA or EPA, any of those sort of combinations of omega-3s is they're relatively safe, and so don't cause a lot of side effects other than like fish burps and smelling like fish, and being able to consume them because they taste like fish. So, I mean, those are kind of the you know, sort of big things to kind of watch out for. But that's my supplement spiel, so to speak.
Appreciate it. Thank you.
Yep.
Excellent. So the last question on the treatment side is, before we move to sort of open questions, was just would a treatment improve quality of life? And I think we've sort of covered that we're not really sure, but you know what's possible. But obviously that would be a key outcome in designing some sort of therapeutic approach, right? Is that quality of life improvement is what everybody is after. And so I would actually like to flip this question into sort of an outcome measures question. If Dr. Shashi or Dr. Peña could maybe just explain what outcome measures are and why it's important to have family input on outcome measures.
Sure. So I can give it a crack. So for quality of life, there's a strong interest in understanding how an interventional treatment actually impacts quality of life. And there are what we call measures that have been tried and true to assess different aspects of quality of life. And that might be mental health, physical health, psychological measures like anxiety, et cetera, and there are some pretty standardized quality of life measures that you know can be as brief or as comprehensive as you'd like them to do, but they have these subset questions that will assess any of the domains that I talked about. And so we typically use those very standardized ones. They're not specific for a particular disease or a particular body system, although there are some that might be developed for that particular disorder. But in general, we just use them to, and there might be a comparison at the beginning of treatment versus the throughout the treatment to see if there's any change in the different subsets or the overall rating of quality of life. And so I don't think that there's a blanket answer to say would a treatment improve quality of life, because I think in many ways that's in the eye of the beholder, and I wouldn't be able to gauge what an affected individual or a family comes in terms of their definition of quality of life and how that might change for the better or for the worse as they're receiving a treatment.
And I think there was a question in the chat as well, Amanda, that we could address with this thing, and that is, with so many variations of symptoms, how would repurposing be focused? Whether it's repurposing or a new compound or an ASO, whatever, ultimately we have to decide what are the outcomes you want to make a difference in. And one of the keys to that, gathering that information, is to know more about the spectrum of ASXL2. What is the most impairing, for example, and is that impairment something that we think will change with treatment? So those are the kinds of variables. For example, seizures, if that's frequent enough, is there a medication, for example, that would make sense to decrease the seizures, specifically in Shashi-Pena as opposed to something else? Or is it aggression? Is it ADHD? So there are multiple different outcome variables that we can use as a way to develop a treatment trial for. And as part of that, the first beginning step is to get more information about the natural history of the disorder. And that's why participating in the registry and the Gene Reviews article, all of the information that you're giving us, those are just the beginning. And I know these are baby steps. And it's frustrating when you have a child not to be able to think that next year we might have a treatment. But these things do take some time. And you want to do something thoughtfully and have outcome measures that are meaningful to the family, at the same time are things that you think you can actually change by a treatment trial. So both have to happen, and it takes some time for that to occur.
All right, thank you. So I think we have time for maybe one or two questions from families. If anyone has a question, if you want to take yourself off mute and we can take a question.
I have a question. In regards to treatment, and Dr. Shashi, I know that at Duke, so our son is diagnosed obviously with Shashi-Pena, but also he was initially diagnosed before we knew anything with global apraxia. And there had been some research with cord blood therapy. So we have banked cord blood for our son. We've never gotten in through the trial through Duke. But would that be a treatment that could be looked at being explored down the road, not specifically to cure Shashi-Pena, but some of the underlying things like that would help with the apraxia, maybe help more with, coordination, motor planning? Has any of that been considered or looked at?
Okay. So you're saying you have your son's cord blood banked and you're asking, can we use that for him? I think in terms of answering that question from a Shashi-Pena perspective, it's not anything that we think would help him, because even that cord blood would have this mutation in the Shashi-Pena gene that he carries in his other cells.
Unmuted. What about a sibling's cord blood?
So we are not, again, at that point of saying that you can make a significant difference with something like that. Remember, there are huge complications when you do a transplant with another person's blood. You need immunosuppression, and they're on those kinds of medications for the rest of their lives. And without any demonstrated benefit, it's not something that we would say is a good option to pursue. I mean, down the road, if there are trials that show those kinds of things help, yes. But outside the context of a research study that has questions surrounding that, I think it would be hard. I think the trials you're talking about are Duke. Loren and I and Becky are not personally involved in those, but our knowledge of those kinds of trials at Duke is for a child who might have had a birth injury due to lack of oxygen. In those instances, having that child's cord blood transfused again might provide some additional cells that can their assumption is that it'll cross the blood-brain barrier and populate those brain cells that are damaged and regenerate some of them. That's kind of the premise behind that. But even there, it's all still very much research. It's not an approved kind of treatment at all.
Thank you.
All right, so we have just a minute left. So I'm actually going to send it back to Becky to give us a final summary of what families can expect to hear from her and what she will need to help move things forward with the Gene Reviews article, and then we'll sign off.
Yeah, thanks, Amanda. So I did put my email in the chat. For anybody who has not reached out to me, you're more than welcome to, just with a little bit of information about your kiddo, maybe the variant. We are waiting for approvals at this point. And once we get all of the IRB approvals of all of the information that we need, I will be reaching out to families to see if you would just be interested in helping us out with the gene reviews. If that's the case, we'll go through the consenting process and schedule a phone call where I'll ask you some basic questions and look to collect medical records so that we can go through those very carefully and really collate what symptoms that we're seeing in kind of this expanded Shashi-Pena cohort. We're hopefully going to get the approvals here in the next couple weeks, maybe, fingers crossed, and be able to get moving. So I will reach out to families that may be interested once all those approvals are done. But if you haven't reached out to me yet, we're always collecting information and love talking to families. So again, my email's in the chat. Always feel free to reach out to me.
Thank you. And I'll put your email in our follow-up to everybody as well, Becky. So,
great. Thank you.
Great. Well, thank you, Dr. Shashi, Dr. Peña, Becky, for being here. Really appreciate it. And I hope everyone has a really nice weekend. And we look forward to a really impactful Gene Reviews article on Shashi-Pena syndrome.
Thank you, Amanda. And thank you.
Great. Thanks, Amanda.
Thanks,
Thank
everybody.
you, everybody. Have a good
Bye.
weekend. Bye-bye.